This is the last question of our debate this evening. The polls tell us all the time the #1 issue out there is health care, and that's what this question's about. Roll tape, please.
I'm Bilal Vakani. I'm from Burlington, Ontario. I'm also a student at Ryerson University. My question is, there is already limited privatization in our healthcare system. Would any of the party leaders consider a larger role for the private sector in healthcare delivery?
Okay, the one-on-one this time features Andrea Horwath and Dalton McGuinty. Ms. Horwath, you go first.
Well, Bilal, I think that the healthcare system needs a lot of improvement. I think by changing the priorities that we have now, we can bring back to Ontario the kind of healthcare that people expect, the kind of healthcare that makes sure that when a mom goes to an emergency ward on a Friday night, she's still not there sometime Saturday afternoon with her child. We need to change the priorities. We need to make sure that we are putting investment into long-term care, because you know what? It costs $1,200 for a person to stay in hospital when they could be in long-term care for about $160 a day. And in fact, with home care services, it only costs $60 a day. So we think that there's a lot of work to be done to change our priorities. Do I think the priority is to add extra profits into the system? No, I do not believe that that's the way to go. I do believe that we need to cap the salaries of CEOs in hospitals. Unfortunately, right now, the priority is that those CEOs get their six-figure salaries while we see nurses being laid off and emergency wards being closed. So a combination of changing priorities and investing in programs like long-term care, like home care, like our new housekeeping assistance program for seniors,
we'll have a chance
will make
to get
a big
into some more.
difference.
Mr. McGuinty?
Great. I want to thank Bilal for that question, and I think it's a very, very important one. That is, it has to do with the future of our public health care system, Medicare. And there's going to be an important event coming in the not-too-distant future. The Premier of Ontario is going to have to sit down with the Prime Minister of Canada and 12 counterparts from across the country and hammer out a new health accord. I was there back in 2004 when I hammered out that accord with then Prime Minister Paul Martin. It wasn't easy. There was some pushing and some shoving, but in the end, we succeeded on behalf of Canadians and indeed Ontarians. The plan at that time was to ensure that we worked within Medicare and to ensure that we reduced wait times and provided more access to more doctors. Here in Ontario, we've enjoyed the greatest success of all. We now have the shortest wait times in the country. Hips and knees and MRIs and CTs and cancer and cataract care, we have the shortest wait times in the country. We've also ensured that 1.3 million more Ontarians now have a family doctor. But this is the important point. I want Ontarians to ask themselves, who do you want sitting at the table with Prime Minister Harper when it comes to standing up for public health care in Ontario? I'm not saying that public health care is perfect, but I think there's all kinds of room for exciting innovation inside public health care.
Ms. Horwath?
And that's where I intend to be.
Well, I think that it's clear that Mr. McGuinty's not talking to the same Ontarians I'm talking to. Everywhere I go, Ontarians are telling me that they're watching their healthcare system erode before their eyes. And whether it's the Anzavino family in Fort Erie who had a daughter in a car accident and that woman had to travel past 2 closed emergency wards before she could get treatment, and she didn't make it. This is the kind of healthcare system that people in Fort Erie and Port Colborne are dealing with, along with a number of other smaller communities that are having their access to emergency wards closed. We see women who are taking breast cancer treatments who are losing their nurses. CEO in the London Hospital got his raise that year, but the nurses got cut out from helping women cope with their breast cancer treatment. The kind of health care that we have in Ontario is not the rosy picture painted by Mr. McGuinty. What people are telling me very clearly is there needs to be a lot of improvement. We have wait times in emergency rooms that are beyond the pale. This is a promise that Mr. McGuinty's made in the past. My own son ended up with a skateboard accident several weeks ago. He went to an emergency ward in my community. They didn't do anything for his fractured elbow. They sent him home, said it doesn't really need anything. They can't afford a cast, and go home and somebody will help you figure out how to put a sling on it. That's not the kind of health care Ontarians deserve. We need to improve our health care system, and we have the plan to do that. Well, the question is, who do you trust to actually start making the changes that put people first and put patients first?
First of all, I hope your son is well. Secondly, I don't think that's a fair representation of the quality of healthcare services provided by our hardworking doctors and nurses and technicians and administrators across the province. The fact of the matter is we put a lot more money into healthcare. We've built 18 new hospitals. We've expanded some 100 others. We've got more doctors and nurses. We've got a great new collection of doctors and nurse practitioners and nurses and dietitians that we bring together called family health teams. We didn't have any before. Now we have 200, and they're caring for 3 million patients. We also have the first nurse practitioner-led clinics in North America. We're putting 25 places here in Ontario. So we're doing everything we can that reach further into our communities and provide still better quality health care. The next challenge for us is emergency room wait times. We're at the forefront of Canada. National experts have said Ontario's right up front, leading on this score. It's not an easy thing to do, but we are in fact getting those wait times down in our emergency rooms right now.
Okay, that brings the one-on-one to an end. We now open it up to include Mr. Hudak, and I remind everybody that the question was about whether there's a larger role for the private sector in healthcare. Mr. Hudak.
Well, I want to thank Bilal for the question. And you know, when it comes to healthcare, for me it's personal. I'm 43 years old. I've been lucky. I've had good health. My little girl Miller, not so much. She was born early, spent a lot of time at women's college. And then recently this summer she was in the hospital for 26 days at Sick Kids. And I saw how hard our nurses are working. I saw how hard our doctors are working, and they're run off their feet. And they say, can't there be a better way? And that's why in our Change Book plan we'll invest $6.1 billion into our healthcare system. It will be our #1 priority to support our nurses, to recruit more doctors to our province and encourage them to go to underserviced areas, to build more long-term care beds, in fact 40,000 long-term care beds in our province, and to make sure that we invest in home care and put the patient, not the bureaucrat, not the fancy consultant that got rich off of e-health, we'll put the patient at the center of our healthcare system.
Ms. Horwath.
Well, and I think the thing that frustrates Ontarians, and it certainly frustrates me, is when the Premier, talks his game about all the investments, the problem is that people are not experiencing improvements in their healthcare system. And so you have to ask yourself, what is going wrong? If all of this new money is being poured in, then there's obviously a problem because it's not reflecting in people's confidence that their healthcare system is going to be there for them when they need it. That's certainly the experience of Marita DeVries. That was the experience of the Anzavino family. That was the experience of my own son. That's the experience of the couple from Sudbury who after 65 years of marriage are being told they have to go into separate long-term care homes. Look, the more profit you build in, I'm going to be really frank with Bilal, I don't believe building more profit in is the right way to go. And unfortunately, both of these fellows seem to have that kind of a preference. I don't. I think we need to make sure that we're investing in the kinds of services like long-term care, home care, keeping seniors safe at home, frontline services, not CEO salaries at the hospital.
Thank you. First of all, with respect to our commitment to Medicare, you will know that we're the only province that on our watch put in a specific piece of law which commits Ontarians to the future of Medicare. That's the name of the very bill itself.
What about home care, Mr. McGuinty?
Well, when it comes to home care, Ms. Horwath, you will know that our commitment, our plan calls for an investment three times the size. But here's my concern.
Private sector delivery model, and you know
here's
that.
my concern.
When it used to be largely not-for-profit and public.
Mr. Hudak says that health care is his #1 priority. A moment ago he said education was his #1 priority. But here's my real concern. Mr. Hudak has not had his plan costed by an economist. He's had no independent verification brought to bear on his numbers. Well, we've looked at his numbers. In fact, there's a $14 billion shortfall.
Hold on
That's
a second.
twice the size of the previous PC government's shortfall.
You know that $14 billion
And remember what happened back then? They closed 28 hospitals. There was war in our schools. We've moved beyond that. We haven't had a single strike in our schools in 8 years. Class sizes are down, test scores are up, graduation rates are up. Our kids are doing better than ever before. And when it comes to health care, again, I say to Ms. Horwath, I know the system is not perfect, but the fact of the matter is we are making real progress.
Okay, Mr. Hudak gets a chance to respond.
Dalton, you know that your allegations about this whole have been discredited. And if you disagree with it, then why did you adopt the exact same numbers we have for revenues, for health, for education? And if your numbers are so great, why did you have 2 sets of numbers in the last 3 weeks? Here's our plan when it comes to health care. We'll strengthen our public, universally accessible health care system with an initial investment, $6.1 billion through our mandate. It will be our #1 investment priority. And, you know, we see these ads from Mr. McGuinty on TV where he claims that things are going so well in healthcare. I just didn't hear that from nurses, from doctors. I don't hear it from patients. And there's really one word we need to remember: e-health. $1 billion that went down the drain, that went into the pockets of fancy consultants who then chose to bill taxpayers for their chocobites and their tea. Sir, the $1 billion in e-health could have built 4 hospitals by now.
A response from Mr. McGuinty, then Ms. Horwath.
By all means, I appreciate the opportunity to speak to the whole issue of e-health because my colleague, Mr. Hudak, has been engaging in a fanciful fiction. I just want to quote back to him the words of the Auditor General, because I think they're pretty important when it comes to these things. He talked about the $1 billion, and in fact, he was once asked at a press conference about that $1 billion all kind of evaporated, as Mr. Hudak would have us believe. He said, that money is going to turn out to benefit taxpayers. The fact of the matter is this investment in electronic health is very important to all of us. So far, we have electronic health records for 7 million Ontarians. By the end of next year, we'll have those records for 10 million Ontarians. We're getting rid of, in fact, we've gotten rid of all the film that used to be used in our hospitals, so that when they move information from one department to another, it's now done digitally. More than that, we're now ensuring that we can move that information from one hospital to another, one part of the province to another. So, notwithstanding Mr. Hudak's disparaging commentary about our electronic health system, we are in fact getting good value for this, and it's really important that we keep moving forward with it.
Ms. Horwath.
I'm going to go back to Bilal's question and state very clearly that I am 100% behind a public healthcare system, one that puts patients first, and Ontarians, I think, are with me on that, and they have to ask themselves a simple question in about 8 or 9 days' time. Who do you trust to keep our public healthcare system in shape and there for you when you need it?
Mr. Hudak.
Mr. McGuinty seems to think that e-health was a big success. I just don't think families believe Dalton McGuinty anymore. $1 billion. They could have built 4 hospitals. We had consultants charging $2,800 a day and then billing for their tea on top of that. And then Mr. McGuinty's government wanted to give the e-health bureaucrats a merit pay increase for one of the biggest scandals in the history of our province. Let me tell you one more thing, too, Bilal, of where I disagree with Mr. McGuinty. He's created these regional health bureaucracies called the LHINs, basically a bloated layer of middle management that gets between the Ministry of Health and doctors and nurses and the patients they're trying to care for. $300 million to date sucked into this bureaucracy where people don't spend a single minute with patients, they don't do any surgeries. As Premier, I will close the doors on those wasteful LHINs and put every penny into patient care instead.
We got a minute left here, so 30 to each of you, please.
All right,
Mr.
on the matter
McGuinty.
of LHINs, I just want to simply quote Conservative Senator Dr. Willie Keon, one of the foremost cardiologists in Canada, and he said this with respect to Mr. Hudak's proposal to eliminate our local champions in LHINs. And I quote, "This would be the stupidest move I've ever heard in my life. It would undo years of progress." LHINs manage health care within the community. They establish priorities. That's why they're so important to all of us in our hometowns.
Andrea Horwath.
New Democrats, if I become the Premier of this province, will make sure that CEO salaries are capped and that money is invested in patient care. I'm going to get rid of the wait lists for long-term care and home care. I'm going to add a new program to help seniors stay safe in their homes so they can stay in their homes longer. And I'm going to cut emergency wait times in half. And I'm going to proudly do that in the context of a public health care system.
Okay, leaders, that is our time for the official debate tonight.